Advanced Psychology, Atypical Behaviour, Part 2. Anxiety and Eating Disorders. Introduction. Everyone has experienced fear. For example, if you are faced with a stressful event like an important examination, you are likely to feel worried and stressed. Psychologists believe that being frightened can have a protective function, because it prepares an individual to take action when threatened. Increasing worry about upcoming exams may be the thing that motivates you to begin revising. Fear also acts as an alarm system to warn individuals of potential danger. However, some people feel afraid without any obvious external trigger, or respond fearfully to harmless stimuli. For example, arachnophobia is an excessive fear of spiders. This type of emotional response is known as anxiety, and it can disrupt normal, everyday functioning. Anxiety disorders are sometimes so severe that the individual requires the help of a mental health practitioner. There are 4 main anxiety disorders listed in the DSM-4 and ICD-10 manuals used by doctors and psychiatrists. These are generalized anxiety, phobias, obsessive-compulsive behaviors, and post-traumatic stress. Anxiety is a central symptom of them all. They are categorized in DSM-4 and ICD-10 as neuroses. Individual sufferers are clearly aware that their anxiety is unusual. They don't lose touch with reality. However, the course of the illness, and the situations in which the individual becomes anxious, differ in each type of disorder. Symptoms of anxiety. Anxiety affects an individual psychologically and physically. It can range from mild to extreme, panic, attacks. Psychological symptoms. A person suffering from anxiety will have feelings of unease, panic, and dread. He or she may feel that, with very high levels of anxiety, they are about to die or lose control of their bodily functions. Patients may find it difficult to concentrate, and feel jumpy, or unable to relax. Physical, or somatic, symptoms. Physical symptoms include an increased heart rate, known as palpitations, and an increase in the rate of breathing. This is called hyperventilation, and is experienced as extreme breathlessness and a sensation of tightness in the chest. Hyperventilation leads to a reduction of carbon monoxide in the blood, which causes the person to feel faint. He or she may also have a dry mouth, a tingling sensation in the hands or feet, headache, back pain, and a frequent urge to go to the toilet. Some people actually shake with fear. Generalized anxiety disorder. Generalized anxiety occurs in a continuous and unfocused way. There are no specific or obvious external triggers to create a feeling of anxiety. In effect, the person is anxious about anything and everything. It is sometimes called free-floating anxiety. It typically begins in the person's mid-teens, Barlow, 1986, and affects about 5% of the population. GAD can have a highly disruptive effect on everyday life and is one of the more difficult anxiety disorders to treat successfully. Phobias. A patient with a phobia has an irrational and disproportionate fear of particular objects, activities, or situations. A phobic person can often acknowledge that their response to the phobic stimulus, such as a spider, is out of proportion to the actual danger it can cause. However, he or she will respond with extreme anxiety if faced with the stimulus, and is highly motivated to avoid any possible contact with it. DSM-4 identifies 3 categories of phobia: agoraphobia, social phobia, and specific phobias. Agoraphobia. This term literally means a fear of marketplaces. An agoraphobic person will have a fear of open spaces. The disorder usually involves panic attacks, which are very distressing episodes of extreme anxiety, often involving palpitations and hyperventilation. People experiencing panic attacks can think they are having a heart attack because the symptoms are quite similar. Usually the person feels most vulnerable to panic attacks when they are furthest away from home or the help of someone they trust. Consequently, they will also avoid closed public spaces, like a supermarket, traveling on public transport, or being in crowds. Severely agoraphobic people avoid going out altogether and become virtual prisoners in their own homes. Agoraphobia accounts for 10 to 50% of all phobias referred for treatment. Gross and McIlveen, 2000. The condition can last for many years. Social phobia. People with social phobia have fears about social situations and interactions, such as meeting new people or eating in public. It is also characterized by a fear of embarrassment or humiliation. The most stressful situations are those where the individual would be under the scrutiny of others. Social phobia usually begins in adolescence or early adulthood. Sterling and Helliwell, 1999, and can last for years. In contrast to the other phobias, males are affected as often as females. Sufferers sometimes try to get over their difficulties with alcohol or other drugs, so drug dependency can be another potential problem. Illness or injury type phobias tend to occur in middle age. Other specific phobias usually develop in childhood, but can occur at any time. Women are much more commonly affected than men. Sterling and Helliwell, 1999. It is the most common type of phobia and the least disruptive to everyday life, as the individual can often simply avoid the specific feared stimulus. Obsessive-compulsive disorder, OCD. This condition is characterized by obsessional thoughts followed by compulsive rituals. Unpleasant thoughts, which may feel beyond the person's control, create feelings of anxiety. To reduce the distress, he or she will engage in repetitive behavior, known as rituals. For example, a person begins to have persistent worrying thoughts about contamination by germs. To reduce the anxiety, the person begins to wash. Anxiety levels drop. When he or she stops washing, the thoughts return and the person has to perform the ritual again. OCD sufferers recognize that their behavior is unusual and senseless, but they cannot stop. If the compulsive behavior is interrupted, or prevented, the sufferer can experience extreme distress, which reduces only when the ritual is successfully carried out. OCD can therefore be severely disruptive to everyday life. Obsessive-compulsive disorder typically begins in early adulthood. Sterling and Helliwell, 1999. Once established, it can persist for many years. The number of people seeking help for OCD has increased dramatically in the last 10 years. It is now thought to affect up to 3% of the population at some time in their life. Post-traumatic stress disorder, PTSD. People often develop symptoms of anxiety after experiencing a very distressing event, a trauma. Usually the reaction lasts for a few weeks and then fades away. In some people, the symptoms continue or re-emerge after a substantial delay. This is known as post-traumatic stress disorder. The symptoms are divided into 3 clusters. 1. Persistent symptoms of anxiety. 2. Avoidance behavior, for example, refusing to drive again after a bad car accident. 3. Involuntary re-experiencing of the event through intrusive, persistent memories and disturbed dreams. Green, 1994, reports that PTSD develops in about 25% of people who experience potentially traumatic events, ranging from 12% for accidents to 80% for rape. The likelihood of PTSD developing increases with the severity of the event, but obviously there are individual differences in how people respond to trauma. Breslau et al., 1998, found that given exposure to trauma, women are twice as likely as men to develop PTSD. The recovery environment, such as support groups, can also have an effect. If a person has a good support network after experiencing a trauma, he or she is less likely to be affected by PTSD.